Kia ora everyone. This is almost everything you'll need to know about the femur. The femur is the bone of the thigh. It's the longest and heaviest bone in the body. The femur is a long bone. It has a head here and a neck. It doesn't have a separate surgical and anatomical neck. It just has a neck, unlike the humerus. It has a long shaft and an expanded distal end. Between the neck and the shaft are these prominent trochanters, a greater trochanter projecting laterally and a lesser trochanter projecting more medially. Anteriorly, the trochanters are joined by a subtle intertrochanteric line, and that demarcates the limits of the joint ligaments, hip joint ligaments, particularly the iliofemoral ligament. The shaft anteriorly is relatively smooth and featureless. Distally, it expands out into epicondyles. There's a lateral epicondyle here and a medial epicondyle here. The medial epicondyle features a tubercle, which is the adductor tubercle. That's for the attachment of the hamstring part of adductor magnus. That's the part with whose fibers descend almost vertically down from the ischiopubic ramus. Most distally, we have the articular surfaces for the tibia, which are the femoral condyles here. Obviously, the head of the femur articulates with the acetabulum of the hip bone. Also distally, the anterior surface of the femur has a patellar surface, and that's where the named large sesamoid bone, the patella or kneecap, articulates. Turning to a posterior view, the head and the neck are still evident. The trochanters here, greater and lesser, are now joined by a much more prominent intertrochanteric crest, more like the crest of a wave here. And there's a quadrate tubercle lateral to the crest for the attachment of quadratus femoris muscle. We see on the shaft that there is now a prominent feature, which is the linea aspera, this thick ridge that flares out both distally and also proximally. The linea aspera centrally has lateral and medial lips, and these are separate proximally. Laterally, this is the gluteal tuberosity here, and medially, the medial lip blends with the spiral line, which is a continuation of the intertrochanteric line from the anterior aspect. It spirals around the proximal shaft of the femur. We'll have a look at that more closely. Distally, the medial part of the linea aspera separates to become the medial supracondylar line, and laterally it becomes the lateral supracondylar line. And again, here we're seeing the adductor tubercle on the medial epicondyle, and the condyles of the femur here much more prominent. In between the condyles posteriorly, we can see a prominent intercondylar notch or intercondylar fossa. And between the medial and lateral supracondylar lines is the popliteal surface of the femur. Looking more closely at the proximal part of the femur anteriorly, this again is the intertrochanteric line, and this will spiral around posteriorly to become the spiral line and merge or blend with the medial lip of the linea aspera. This is similar to how a slide spirals around a helter-skelter in a theme park. Old school. Looking closely here, we can see this pit in the head of the femur. That's the fovea, and is the site of attachment of a ligament which helps to stabilize the femoral head in the acetabulum. And there are numerous vascular channels in the bone for blood vessels that supply the head of the femur from more distally. So in this way. And from the posterior aspect, again, these prominent vascular channels, the intertrochanteric crest, and this hollow area here is the intertrochanteric or trochanteric fossa, which is the site of attachment of obturator internus and externus. There is a quadrate tubercle here for attachment of the quadratus femoris, We see the medial lip of the linea aspera, which will blend with the spiral line from the anterior aspect, and the gluteal tuberosity here, where some of the fibers of gluteus maximus insert into the femur. In between these two lines, in between the gluteal line laterally and the spiral line medially, and just below the lesser trochanter, is a third line, which is the pectineal line. So gluteal tuberosity, spiral line, and here the pectineal line, which is for the attachment of the pectineus muscle from the pecten pubis. This is often an area of confusion because of the many different lines and muscle attachments, but they can be remembered back to front because I've selected the right femur to study here, but the GPS you can remember as a way to help you not get lost when studying the posterior aspect of the proximal femur, hopefully. In addition to the muscle attachments I've already mentioned, many muscles attach to the linea aspera on the posterior aspect of the femur. We've already mentioned gluteus maximus attaching to the gluteal tuberosity, pectineus attaching into the pectineal line, and the spiral line is the site of attachment of the most medial of the quadriceps femoris muscles, which is vastus medialis. So it blends in with the medial lip of the linea aspera. The most lateral attachment is for the most lateral of the quadriceps muscles, so they wrap around the shaft of the femur, and so that is vastus lateralis. In between these attachments, we have the distal attachments of the adductor group or medial group of muscles of the thigh. The most anterior of these is adductor longus. It's a long muscle, so it attaches relatively distally on the linea aspera. Proximal and slightly deep to it is the adductor brevis, a shorter muscle, but the attachments overlap just a little bit. In a dissection, the adductor longus tends to overlie and hide the adductor brevis from view. Lastly, the very large adductor magnus runs posterior to both brevis and longus, more towards the lateral lip of the linea aspera, but also attaches to the adductor tubercle. The hamstring part of adductor magnus attaches there, and in between those attachments there is a hiatus or a gap in adductor magnus, and that's for the vascular bundle to travel through, which we'll see later. So this linea aspera is a complex area with a lot of muscle attachments, but I'll just label them. Gluteus maximus to the gluteal tuberosity, vastus lateralis, vastus lateralis, most laterally, vastus medialis, most medially, pectineus into the pectineal line, adductor brevis proximally, adductor longus distal to it, and adductor magnus posterior to both of the other adductors. We'll look at each of those muscles in more detail later on. So that's almost everything you need to know about the femur. Next time we'll look at the tibia and fibula together, the bones of the leg. But until then, ka kite.